Right now, scientists in Israel releasing a new study showing cancer cells grow and spread around the body more quickly during sleep. Joining me now, Dr. David Spigel, oncologist and lung cancer program director at Sarah Cannon Research Institute. Doctor, this is so interesting. What do we know, what don't we know from this study?
Well, first, thanks for having me. Pretty interesting study. People have always wondered, does cancer grow at different times of the day at different rates? So this is a small study, and it's based in mice. That's important to say up front. But the investigators were just trying to understand, does cancer grow faster? Does more cancer grow during the daytime or at nighttime? And they discovered at nighttime there appeared to be in this one model more cancer growth. Okay, so during the day your body acts differently, the way it's regulating things and kind of taking care of itself, or at least when you're awake. That's correct. And it may have something to do with hormones. In fact, these investigators looked at the levels of steroids. We have steroid in our body. It's cortisol. Those levels seem to drop at nighttime. They go up in the morning. And that may be a protective effect during the daytime. But at nighttime, when those levels are low, it may allow some cancer signals to be promoted. Okay, so would it change treatment? Would you schedule treatment, say, if you're doing chemo, would you do it at night? Could it impact those kinds of things? Yeah, so the lead investigator made that comment that this is really not an issue of changing the type of therapy, but maybe when we give it. But, as we move more into therapies that are oral, so pills that patients take during different times of the day, and eventually these drugs reach what are called steady states or steady levels in your body. So you wonder if it really makes a difference if you've been on a medicine that's at a constant level in your body throughout the day. But it could have implications if this proves to be true in humans. All right, we want to talk about some good news. We need that, especially on the health front these days. CDC saying we're all living longer these days. Right. So this was a report that came out yesterday that the life expectancy continues to go up. And we were joking that actually for women, this continues to be an advantage over men. So women now can expect to live to be just past 80, about 81. Men are a little bit behind, about 4 or 5 years. Always seems to be the case. Okay, so is it better diagnosis? Is it better management of conditions that we have? Are there cures? What's driving this? Yeah, that's a good question. The leading causes of death still are heart disease and then cancer, and many predict cancer will overtake heart disease in the near future. So speaking for cancer, we can look more closely at that, and we know that cancer treatments are getting better. We know we're finding cancer earlier with screening for things like prostate cancer, breast cancer, colon cancer. That probably is impacting the survival rates, at least for the cancer population. All right, and very quickly, one troubling note was that suicide is up. Is it that we're not managing mental health care as well? Yeah, I saw that. So of the leading causes of death, all were reduced except suicide. That was really disturbing. I think even experts in suicide don't quite understand that, but certainly a call for attention to that topic. All right, doctor. Good to see you. Thanks for stopping in today. Eric?